Politicians across the UK and Europe are watching how Italy copes with coronavirus very closely. Boris Johnson said we are only 2 or 3 weeks behind the Italians. It's not the happiest of prospects, since the death toll there is now more than 10,000 and on the rise again after what had seemed like a peak earlier this week. Pierpaolo Sileri, Italy's health minister, has himself recovered from the virus, and I spoke to him this morning and asked him, after the latest figures showed nearly 900 people died in Italy in 24 hours, if the lockdown was working or not.
I believe the lockdown starts to work. I mean, we started the lockdown at the middle of March. I mean, we did start with the first lockdown between the 8th and the 9th of March. So obviously you need to wait at least 14, 17, 18 days after that to see the reduction of number of infected people. Over the last few days, we had an increase of infection, and this was due to the increase of the swab that have been performed. So we are searching more. And obviously, we have more results of positive people, mainly with low and without symptoms.
Sorry, can I ask you to explain exactly what has changed, do you think?
Over the last 3 days, we start to do more swab, especially to trace and
so
people.
You're testing more, basically.
We are testing more, exactly. And obviously, when you test more, you may find more positive people, and this will explain the increased number of positive that we found over the last 2 days. But I believe that we are living in the peak of this epidemic. I believe in 1 week time, 10 days maximum, we will see a significant drop of positive cases.
And a drop of deaths, because as I say, 900 yesterday, that's a huge number, and 10,000 in all.
Now we have 10,000. Up to yesterday evening, we have 10,000 people who died, but you know, who died are people who have been infected several days ago. So if you reduce the number of positive people, obviously, over time, you will have a reduction of the dead people.
Am I not right in saying that those cities and municipalities which imposed the lockdown a little bit later, which waited before the lockdown, have had a much worse impact than those that locked down early on?
We did start immediately with the lockdown of the cities where there was where there were the first outbreaks. And this was the south part of Lombardy and in Veneto. And then we have seen other outbreaks in Lombardy and after that, even in the other part of Italy. I mean, lesser number in the central part and south part of Italy, and then we immediately did the lockdown of Italy after that.
But the Chinese have reportedly criticised Italy for not locking down harder earlier, allowing public transport, for instance, to carry on.
You know, I believe we've been very, very fast in this. We've been very unlucky to have several outbreaks, and we didn't find the patient 0, and even our patient 1 probably was not a patient 1. So we had several outbreaks in a very, very active part of our country, that is Lombardy, and this is obviously had an impact on the number of people who've been infected.
It has been suggested that Italy could yet go further with the lockdown and introduce even more stringent measures. Are there any more stringent measures you could introduce?
Right now, I mean, there is, I would say, almost a full lockdown of the entire Italy. I mean, we are working just for, you know, to primary assistance of people, including, you know, food and other stuff like this. But if you go around in Italy, in Rome or in Milan, the number of people who are going around you can count on one hand, basically.
Yeah. But this is not a situation which can go on forever. I mean, there have been lots of reports of people feeling very, very angry, very, very upset inside their homes. The mayor of Palermo has said discomfort and malaise are growing, and we are recording worrying reports of protest and anger that is being exploited by criminals who want to destabilise the system. In other words, for how long can this carry on going?
Honestly, there were just few cases in the south of Italy. I mean, obviously not a lot actually. Obviously, cannot go this forever. And we do plan to restart life, but to restart a normal life, we need to be sure that this pandemic is almost over and the risk of contagious is very low. I think the most important thing is to check how many people get the disease or have immunologic response. I mean, and to do this, we need to wait. I believe at least other 2 weeks are necessary before we can do a prevision of what is going to happen over the next month. It's very early.
A study by Bergamo University suggested that hospitals themselves may be vectors of infection, and particularly ambulances going around the countryside may have been spreading coronavirus. And I'm wondering, with that perspective, what Italy's advice is for us.
I think worker protection is very important, and what we observe in our hospital has been observed in China, and I believe is the hospital is the place where it's possible you can get an infection. I mean, this happened even before the coronavirus. I mean, we all know that in the hospital, you may get an infection, sometimes a resistant infection too. Obviously, if you have an infected patient, you need to have within the hospital an area that is just for COVID people. I mean, they cannot be the same hospital, completely separate hospital. You cannot have a COVID patient that has been to move from infectious ward to the radiology. And I mean, a COVID hospital, I think, is mandatory. The other most important thing is you need to improve the primary care in the outside the hospital. I mean, especially for who is sick and is at home. It needs to be controlled by medical doctors at least twice a day, because this is a very deceitful disease. So you may have fever for a few days, and then your lungs go off, and then you need an ICU bed immediately. So you need somebody who looks after you very, very closely, even if you are at home.
Now, you're in the unusual position of not only being the health minister, but also a doctor yourself on the front line. Now, 51 doctors have died so far from coronavirus in Italy. And I just wonder, do you feel as a politician that your government has been doing enough for your medical colleagues?
I think we are doing the maximum for our colleague. Unfortunately, we had more than 50 between doctors and nurses who died. And obviously, we need to do our maximum efforts to give them protective masks and whatever they need. So, but you understand that when you start to have outbreaks all over Europe, even the material is lacking. It's very difficult to find masks. It's very difficult to find ventilators or whatever you need. I believe we need a European strategy to fight against this disease.
Now, you yourself have had coronavirus. This is your first day back at work, I think. Can you tell us, were you able to function at all while you were off? How ill were you? And congratulations on being back.
Thank you. This is my third day of work. I'm back since 3 days ago. As I told you, this is a very deceitful disease. I mean, you start with some fatigue, and then you got fever, and then you got cough, and then you start to be very, very, very ill. I was very lucky because in 1 week everything was over. But when they gave me the result of the swab, obviously I was worried for me, mainly for my family or all the people who were around me during the last days. They worried to infect somebody that was close to you, but we always respect the distance. So, unfortunately, to be honest, we were very fortunate because nobody around me got the disease, even my wife and my little child. After a few days without fever, I did a swab, 2 swabs within 48 hours, basically, and both were negative. So now I'm back to normal life.
Well, congratulations, Minister Sileri. Thank you very much indeed for joining us this morning.
Thank you. Thank you.